Just heard Ebola mentioned in that last report, and experts say there are some similar lessons to be learned from each outbreak. Dr. Joel Selanikio knows this well. He spent some time in Africa last year working to fight the Ebola epidemic. He is also the CEO and co-founder of data collection software Magpi. Thank you so much for joining us. Welcome back to the show.
Thanks for having me.
Talk to us about the similarity between the spread of Ebola and the spread of MERS, and talk about the lessons, as we heard just a moment ago, that can be learned from each one.
Well, I think there's more differences than there are similarities. Although perhaps the similarity is just the fact that we seem to have been unprepared for both. But in terms of Ebola, this is something where most of the spread was in communities. Lots of hospital spread as well, but something that's very, very infectious, something that's easy to get. Whereas in the Republic of Korea, as we've seen, it used to, until yesterday it was all, but now most of the cases have resulted from people who were exposed in hospitals. That is to say, very little community spread. Ebola, lots of community spread because it's easy to get. With MERS, apparently not so much. And we're still not sure how it's spread. We just know that it's not spreading within the communities. And so the government of Korea needs to, of course, go and take care of the situation in the hospitals, which, as we've just seen, they understand quite well that they have to do.
We just heard about some nurses being infected recently. Chinese and American scientists, we've been reporting this week, have been developing a new antibody to target MERS. And they say that so far the test results are fairly positive on some of the trials they've done. Talk to us generally, though, about the difficulty of developing vaccines and antibodies to viruses like MERS, like Ebola.
Sure. Well, so antibodies, while difficult, are actually quite a lot more easy than making a vaccine, for example. So with the idea behind an antibody, of course, we all understand how those work within our immune system and are able to recognize and to help defeat different disease organisms. And so the idea is if you make an antibody that's specific to a particular disease, whether it's Ebola or MERS, that this will help the body to fight off that infection. We saw this with Ebola, or at least we think we did. There were really too few cases in which that approach was used for us to really draw conclusions yet. But we think that that in Ebola, for example, giving serum taken from the Ebola patients that we had, like the doctor who was infected who came back to the States, that seemed to help other patients recover. Again, too few cases to really draw any kind of statistical conclusions, but it makes good scientific sense and it appeared to be working. So the idea, of course, would be then, all right, now we've determined that an antibody can help. How do we make enough of it to help a huge group of people? And that's also quite difficult because in the United States, as we saw with Ebola, even once we realized it seems that antibodies to Ebola are helpful, I mean, how do we get these things in mass production in a laboratory or factory so that we can give them to enough people? That's really the difficult part. Vaccines is a whole different story because you have to try and actually, it's not just a question of recognizing the molecule or the different antigens of a particular pathogen. It's a question about understanding how the pathogen infects people, at what stage do you want to act, et cetera. So it's considerably more difficult to develop a vaccine, which of course is why we still don't have a workable vaccine against Ebola. But I want to emphasize that in both of these cases, the reason we have so many cases is because infection precautions have apparently not been followed. And you mentioned the nurses. I mean, at this stage, for nurses in hospitals in Korea to be contracting MERS is crazy, right? I mean, because the way that you avoid it is simply to use the standard precautions, respiratory, airborne precautions, hand washing, masks, gloves, et cetera. Standard things that every nurse and every doctor knows how to do. So it's a bit surprising that they're still getting cases in health facilities in Korea when, again, the solution to prevention is actually quite simple.
Talk about technology and how technology can be used to sort of harness the fight, work towards finding a solution here.
Well, one of the things that you have to do in any kind of an outbreak, and this was true in Ebola, or continues to be true actually in West Africa, and it's certainly true in the Republic of Korea, they have to identify probable cases and contacts of cases, right? They have to identify people who are likely to become sick or possibly may become sick and isolate those people so they can't potentially infect other folks. This is the contact tracing that we heard so much about during the heyday of Ebola, really just a few months ago. And of course, in order to do that, what that practically means is that you're going out and interviewing people about what kind of contact they had with different, with cases or potential cases. And you're writing all that information down. Now, if you're writing that information down on paper, for example, as traditionally has always been done, there are delays involved in getting that paper typed into a computer so you can run some kind of analysis. So we at Magpi and plenty of other folks as well have been working on ways to automate that process. I mean, simply to move away from paper. We certainly recognize that, using electronic means for, keeping track of our bank accounts is quite useful compared to paper checkbooks. And certainly that applies to epidemiology as well. So we're I think, making great strides with just making that contact tracing process a lot more efficient and a lot faster.